People are always wanting to know whether they're a good candidate for Votiva. This is an absolutely amazing vaginal rejuvenation procedure, which is appropriate for basically most women as they hit their post childhood era or postmenopausal era. And you'll find that they'll be complaining of vaginal laxity or dryness or even stress urinary incontinence. And this procedure will actually address all of those issues. So one of the reasons why I went with Votiva is because it's radio frequency. The amazing thing about radio frequency is I can use it both internally and externally. And what it does is it stimulates the collagen. It will heat the tissue up to between 38 and 43 degrees Celsius. And then that in turn will lead to neocollagenesis, which is the formation of new collagen, which then strengthens and plumps up the tissue. One of the best things about this is it is a non-surgical procedure, which is giving close to surgical results in a lot of the different areas, specifically in our urinary stress in continence. It's a quick procedure. We do it in the office. We do usually a series of 3 of them between 2 and 4 weeks apart. So stress urinary incontinence is a very common problem that a lot of our women have, either post-childbirth or just as a fact of aging. And they find that they'll lose urine when they cough, a sneeze, or jump up and down. And what the Votiva does is it leads to the neocollagenesis, which is basically rebuilding and thickening of the vaginal tissue, which in turn helps to alleviate the symptoms of stress urinary incontinence. And it has been absolutely life-changing for many, many of my patients. They've gone for years and years where they go into the gym and they'll jump up and down and they have to run out and go to the restroom again and again. And I find with a majority of my patients, even after their very first treatment, they're already seeing changes. I'll have people call me like 2 or 3 hours later saying, I just sneezed and I was absolutely fine. So it's really, really gratifying. You do, however, need 3 because you will get improvement just with that one, but in order to get a sustained improvement, we need to do 3 of them so we can really get that collagen built up. So again, vaginal dryness is another issue that a lot of our women have as they age. And with the Votiva and the radio frequency, you're heating up the tissue, causing that neocollagenesis, and it just helps to rejuvenate even the lubrication of the vagina. Again, absolutely game-changing for our aging women population. So a lot of our women are complaining of dryness as being a significant issue, which is impacting them sexually in their relationships, leading to painful intercourse and then lack of interest because of that painful intercourse. And with this, we're finding with that rejuvenation, they are getting their lubrication back again and back to enjoying their sexual encounters. Votiva is good for most women. We do have a few contraindications to it. One of the major contraindications is if you have an implantable programmable device like a pacemaker or a defibrillator, as the radio frequency can interfere with those signals. The other thing we want to know about is if you've had cancers like cervical cancer, that's something we'd have to discuss with your gynae oncologist to see if you're a candidate and how far out you are from treatment. Other things like infections, and if we have people that are prone to infections, we may want to prophylax them with an antiviral. The wonderful thing about Votiva is it is absolutely pain-free. I do kind of laugh and say it's kind of like a 10-minute pap smear. So it's a little bit uncomfortable, but it certainly doesn't hurt. What I often will do is I'll chatter with my patients while we're doing the procedure, or I'll get them to play on their phone, read, shop on Amazon, a number of different things that we can do to help to distract them. The internal treatment really is only about 10 to 15 minutes long. I can treat the external area to help plump up the tissue as well, and that's about another 10 or 15 minutes. So in all, you're really only about a 20 to 30 minute procedure. So many people are a bit embarrassed or sensitive about discussing, problems with vaginal laxity or urinary stress in continence. So it's important for me to reassure them that as a medical doctor, I will be the only person who will be performing the procedure. We do a one-on-one consult to discuss whether you're an appropriate candidate, and then the procedure will be performed by myself. Hi, I'm Dr. Nicole Kent, Medical Director at Tranquil Waters Med Spa and Physician Trainer with InMode. Come visit us at Tranquil Waters Med Spa to have a private consultation with an MD that you can trust.